Alright, so this is the video companion for the blog on the SC joint and the clavicle. If you're interested in reading more about that, go to optimalsportsperformance.com. Just type it in the search box and you'll find the blog article on the clavicle and the SC joint. But these are the muscle energy technique treatments that were described in that blog article. First, the two assessments that we talked about, we're assessing how the clavicle and the SC joint move in both abduction and horizontal flexion. For the first one, for abduction, all we do is we find the medial portion of the clavicle right at the SC joint. We put our index fingers right on that medial portion of the clavicle and we ask the client to shrug their shoulders. So go ahead and shrug your shoulders. Perfect, good. And we look for a cauded movement of the clavicle, so downward movement of the clavicle. And we're looking for both symmetry and or if they move. So as the shoulders shrug, the clavicle goes upward and also posteriorly rotates. And any limitation that we find with that movement, we can then treat it with the muscle energy techniques coming up here in a second. You can also do this assessment seated. The other assessment for the horizontal movement, the client is going to take their hands, place them in a prayer position facing up toward the ceiling, and all we're going to do is, again, using our index fingers, we make contact with that medial portion of the clavicle and we have the client reach towards the ceiling. So go ahead and press up. Perfect. And relax. And as they press up, we're looking for the medial portion of the clavicle to move downward toward the table. So the first treatment that we'll do is for that horizontal movement. If I wanted to treat the client's left clavicle, what I would do from this side is I would take my hand, place pressure with my hand right on the medial portion of that clavicle, just gentle pressure. This should be pain-free, gentle but firm. I'm going to ask the client to take their arm and place it either on my shoulder or around my neck. Okay? My other hand reaches around their scapula and I gently lean back to take up the slack. Once I feel the end range, I ask the client to gently pull down against my neck, nice and easy, about 20 to 30% of their total force. They pull down as I maintain my pressure and we hold for 5 seconds and then they go ahead and relax. And as they relax, I have them take a breath in. And then when they breathe out and they relax, I again lean back and lift with my hand and try and take the slack out. And then we can repeat this movement again. So go ahead and pull down. We hold for 5, 4, 3, 2, 1. Relax. Take a breath in. And breathe out and relax. And I maintain that downward pressure on the clavicle as I gently take the slack out. To treat the abduction movement, I'll have the client go ahead and sit up and just slide down here towards the end of the table so I have some room. So all I do with this one is I use if I'm treating the left shoulder, I'll use my right hand, I'll reach around to the medial portion of his clavicle, and again I'm going to apply some downward pressure. I'm going to take his arm and abduct it to about 90 degrees with the elbow abducted, or the elbow flexed. I maintain my gentle downward pressure, and I have the client give me some adduction, so pulling his elbow down towards his side into my hand. Again, 20 to 30% of his effort. We hold for about 3 to 5 seconds, and then relax. He takes a breath in. And as he breathes out and relaxes, I maintain my downward pressure, and then I slowly lift the arm a little higher, and we can repeat. Go ahead and push down. Relax, take a breath in, and breathe out and relax. And again, maintain that downward pressure and abduct to the next resistant barrier. So that's treatment for the SC joint and the clavicle. Again, you can check it out on the blog, optimalsportsperformance.com.